Hi guys and welcome. Today I'm going to talk about something a little different. I'm going to talk about hip labral tears and my experience with them because I found my surgery tapes, which I know sounds really creepy and weird, but don't worry, it's not like a top-down version of them like doing surgery. It's like laparoscopic so you can see the inside. But recently I found that, and also my hips have been so sore. I have chronic pain anyway, but my hips have been so bad lately. So I'm in bed with a heat back like usual, but they're just extra worse lately. So just talk about the experience of like diagnosing hip labral tears and like the procedure of like getting them fixed and like recovery. So let's get into it. So for me, it took quite a while to get the diagnosis of labral tears. I did have a car accident, which caused a lot of injuries, but it took a while for them to figure it out. And I was at the same time getting diagnosed with different medical conditions and stuff. So a lot of it kind of skewed looking at like physical injuries. So it took about 5 years to get diagnosed, and you need to get an MRI, but it has to be a very specific kind. It has to be a direct MRI. So they inject dye, like contrast dye, into your hip so they can see the actual tear. If you think you have a tear and you want to get it checked out, make sure you ask for the right kind of MRI. This is very important. And if you're wondering if the pain in your hip could be a labral tear, there is some signs. A lot of times, like, it depends on where the tear is in your hip. Mine was like almost all the way around, like it was massive. But usually you get groin pain. It's pain all throughout your hip. It's like a lot of burning sensation. One of the main things too is you'll notice like a clicking, clunking sound, and you'll feel it as well. Like you'll feel like your hip is like dropping. And they'll also do tests. If you have this, like they'll test like your abduction and adduction and just see how your hip moves. But everyone's a little bit different because I ended up having a connective tissue disorder, so my movements were a little strange, so kind of threw off the results. So you definitely want to get the imaging done to know for sure if you have these tears. And then when it comes to the procedure, it's usually a pretty quick procedure. I was like about an hour. So I had labral tears, pretty big ones, and I also had bone spurs and a hip impingement. So we got those taken care of as well. And it was, I think, like about an hour, so it wasn't too bad. So they go in and they kind of like, if you have bone spurs, they clean up the bone spurs, and then they start suturing your labrum back onto like your, what would it be? I guess like the other part of your hip. I'm not medical enough to describe this, but they start like suturing it so that they're fixing the actual tear in your hip, and eventually those will dissolve and everything will heal back together. Actual surgical video that I don't think I can show, even though it's not that graphic, I don't think I can show it, but maybe I'll put some photos in and we'll see if I can keep those in or not. But during the actual procedure, I could see them cutting and scraping and suturing, and then you can hear them talking to me, explaining what they're doing, which was really cool and fascinating. So I got to watch both of my surgeries and to see what actually happened to my hips and see like what they did. So that was really fascinating, even though it was kind of creepy, and I watched them way too soon after I had my surgeries and it made me a little sick. But it was very interesting. After this procedure, it takes about a year to be recovered, but it's about 6 months of like active recovery, of going to physiotherapy, doing exercises at home, and like dealing with it, as well as I had to wear this specific brace. I'll show you it. I had to wear that for 6 weeks. Most people wear it for 4 weeks, but because I have loose joints, it had to be 6 weeks, which is incredibly annoying. At first it's not so bad, but then you're wearing it literally all the time, except if you shower, and it starts to get very painful. But you do need to wear this to help like keep things in place. Some surgeons do it, some don't, but it is, I think, highly beneficial to have these, as it keeps your hip kind of stabilized. And depending on your surgeon, like your recovery kind of depends on that. Like my surgeon is very like well recognized in his field, and he often deals with athletes. I'm not an athlete, but he does deal with athletes. So his recovery procedure is quite intensive, which is a good thing, right? Like you want to have like a really good recovery team and process. And he also ended up doing Durolene injections. Now, usually you do this when you're in the surgery. My first one happened fast, so I had to do the injections afterwards. So you can get this Durolene injection that kind of coats the inside of your hip. It's just kind of thick. It's good for when you're healing. So it just kind of like coats that area. But you don't have to get it. I ended up not getting it on my second hip because I had a reaction to it, so I just didn't do it a second time. But I definitely, even though I still have chronic pain everywhere, but that's from other issues, I definitely was happy that I got the procedures done. Like, it was so worth getting the surgeries, and if I even had to get it done again, I definitely would choose it because it did make a difference. That they're able to go laparoscopically, it's so invasive. Like, I have tiny little scars, like barely even noticeable. If that's something that people worry about, it's really like you're gonna heal up quite well and barely even notice that you had like a surgery. Like, my scars like are almost impossible to see. So thanks for joining me as I talked about Thanks for joining me as I talked about my labral tears and like talking about them. Hopefully that was kind of interesting, and if you are someone who is having hip problems and don't know what's going on, maybe check into labral tears. Sometimes they get missed, especially physiotherapists sometimes don't always think to check for that. Same with doctors, they don't always check for that. So if you're having issues, and they can happen in your shoulder as well, so if you've been having issues in your shoulder, you can ask to see if there's any labral tears. But thanks again for joining.